once you're postmenopause forever. So you could be 99, you're still postmenopause. And a lot of these things that kind of start pre or peri bleed into the postmenopausal phase and gain momentum in some ways in terms of how it impacts her health.
Hello, everyone. I am excited once again because we have a friend to the show back for another episode, Dr. Susan Baumgaertel. And I just want to give you an opportunity to just do a quick recap and tell us a little bit about yourself and your journey to medicine for those who may have not heard our previous episode.
Oh, thank you for having me on. It's such a pleasure to be here. And I can't believe our last episode was almost a year ago. Oh my gosh, time flies. Well, it's just really, these kind of events make me think about where have I come from, right? And so I trained in medicine. Actually, that was 30 years ago when I became an MD. Oh my gosh. Before that, I was actually a student in architecture and urban planning. So that was my undergraduate degree. Planned it all along, went into med school. That was in Seattle, Washington, University of Washington, and stayed there for my residency in internal medicine, and then went right into private practice in a very large, multi-specialty position-owned group, and was there for 25 years, owner and shareholder and so forth, and then pivoted. So my career took not quite a U-turn, but a dog leg if you're a golfer, and decided to really go more into kind of my own business, so an entrepreneurial pathway. And I formed my own business called myMDadvocate. And really what I do is help patients in Washington State in a telemedicine platform. And I help them with medical consultations and advocacy, kind of navigating the system and doing a lot of other things too, kind of safety net care. So along the way, during the pandemic, I had a passion project, and it was a free website called MenopauseMenu. And it was kind of a place for me to put my creative energies and kind of collaborative energies in one place. And that was also the platform upon which I then eventually wrote a book. So it's just been really a very fun ride, and it's great to be here.
I'm so excited that you're back, and I want to touch on all of those kind of things because, as we talked about before, menopause is kind of one of those forgotten areas of medicine. We talk a lot about like pregnancy and prenatal care and people who are in their youth and sports medicine and all of these different genres and things. But women, people, and they age, and it's okay. And there's more to menopause than hot flashes. So you are fighting to kind of advocate for women and advocate for menopause education and exploration. How would you recommend that students work to approach patients who are in the state of menopause? Because, of course, a lot of the students who are listening will be, one, either seeing people on their new clinical rotations, or they may be thinking about going into geriatrics. They may be volunteering at a nursing home or want to be a nursing home medical director or something like that. So, like, how would you approach someone who is in a menopausal state?
Great question, and super great for our listeners who, many of which are probably in training now, need to think about. And I think actually kind of the first step really would be thinking about what's the definition? Like there's a difference. Pre-menopause means before. That's usually anywhere up until, kind of the mid-40s. And I'm talking about natural menopause. And then peri, that word peri, like perimeter, means around. So peri is around the time of menopause, and that can be different for every woman, but it could be, starting in the early to mid-40s to even into the 50s. And then menopause, the actual term menopause is really, the definition is 12 months without a period. And again, we're talking not natural menopause, not surgical and so forth. So 12 months without a period, boom, technically that's menopause. And then here's the ringer. Post means after. Like, postmortem. Post-menopause means anything after menopause. So this is where a lot of actually patients get a little confused. I've had patients say like, well, I'm 65, I'm done with all that. Like, well, yeah, but once you're postmenopause forever. So you could be 99, you're still postmenopause. And a lot of these things that kind of start pre or peri bleed into the postmenopausal phase and gain momentum in some ways in terms of how it impacts her health. So that entire journey, which I would loosely label as midlife, is important, I think, for students and trainees and residents, no matter what field they go into, to really understand. And I think another thing that really is important to know is that even though there's a lot of commonalities, and boy, anytime anyone's gotten together with a girlfriend or an aunt or a mother or a sister, and they say, oh, this happened to you. Oh, yeah, it happened to me. There's a lot of commonalities. At the same time, there's a lot of differences. And so a lot of nuances. Each individual woman, each individual patient may be experiencing different things at different times to a different degree or severity. So I've had, I can't tell you how many times I've had so many women say, oh my God, it was 8 years of hell, before they kind of, kind of felt like they were themselves again. And then others who'd say like, oh, I had one bad period and that was it. Poof, I was fine. It's like, oh, everyone's going to punch you. So again, it just kind of tells you that there's such a difference even among individual women. And I do say, again, from a training perspective, it's so important to know that, there's that word multifactorial in medicine, where there are many things causing a condition or a symptom. Well, there's so many different disciplines that overlap when it comes to care of women who are in midlife. And it could just be obviously primary care, internal medicine, family practice, could be OBGYN, of course. It could be cardiology, it could be dermatology, it could be rheumatology, neurology. I mean, all the ologies, they all have a role in helping and evaluating and treating and caring for women who are in midlife. So that's really key. Lastly, I'll say, so important, people need to listen to actually hear their patients, because so many times these symptoms that can be egregious or very disrupting can kind of be swept under the carpet when you're, for instance, a patient, you're going in for a follow-up on your blood pressure. And so the conversation about your blood pressure medicine, when actually it's something, that something more egregious is happening to you, or is upsetting you as a woman who's going through a menopausal phase. And so just being receptive, being able to listen and hear and being there is of great value for women.
Absolutely. And as you mentioned, it's different for every woman. It can happen at any age. How should those, like you said, everyone's going to touch someone in menopause. But of course, there are some specialties that have a little more high touch, OBGYN, primary care. How should you be preparing and educating your patients about the different stages and phases of menopause?
Yeah. Actually, I think everything I just said for, people who are in the profession of caring for women, everything I said applies also to the patients. And I think that this is where it's important, I feel, and that kind of was the impetus for kind of garnering my website and getting information out there. It's important to pay attention to the information sources. So a lot of patients will go to dare I say, Dr. Google. They'll go to the internet and they'll just search stuff, which is neither better nor worse, but then they'll also maybe talk to their colleague at work, or their kid's mom, or whatever it is, that kid's friend's mom. And things they pick up may be helpful, or they actually may be very harmful. And dare I say, snake oil salesman and the whole celebrity buy my product kind of stuff out there, which, frankly, is there to make money. It's not there to educate women or to be a resource for women. On the flip side, the kind of slippery slope, that kind of other side of the coin, is that you can go to a very reputable website and unfortunately get really bogged down with a lot of medical terminology and complex discussions that are kind of, outside your range. So I think it's important for information sharing to be very focused and very direct and very helpful. Now, that assumes, of course, that the person taking care of a patient has that knowledge. And I think it's important to think about your own resources, be it journals or organizations or colleagues. And if it's not something you're really comfortable with, to refer out to another specialty, perhaps. So educating patients that there are many resources available, but to be wary and mindful of what they are. Asking for time. So this is a hard one, I think, for all patients, but certainly for women. When you go to an appointment, it could be a physical, it could just be a follow-up for something. And like you're watching your watch, that there's a limited amount of time. And it's almost like you don't want to bring up a subject because you feel like they're not going to be receptive to it, the doctor, or they're not going to have the time for it. And I think doesn't mean you have to be selfish or rude, but you can actually ahead of time say, look, I really want to talk about these 3 things that are really important to me. So when your visit's starting, that's kind of right up front. And then your doctor can kind of gauge their time and interest and ability to interact. So it's really, in a way, it's being an advocate for yourself. So an example would be, let's say it's vaginal dryness. Well, that may not be a topic, first of all, that everyone's comfortable talking about, or maybe it's embarrassing to some women, or they just like, ooh, that's not table talk. We never talked about that in my home. So, but you should be able to talk to these things with your doctor, who hopefully is going to have the time and the interest to listen and then, kind of give you a dialogue in terms of things you can do. It's not going to happen if your follow-up is for blood pressure management and medication refill and, I need a referral to see physical therapy for my knee. They're not just necessarily say, let's talk about vaginal dryness. So again, it's making that a priority. And the more we do this, the more this becomes the norm. And talking about any kind of female issues, but particularly those around midlife.
Setting agendas is so important. I love that you mentioned that if you have something that you want to talk about, sometimes it may not be in congruency with what the doctor has on their plan. So highlighting that and letting them know what's important to you so you can work together to kind of work through things. So it's not always that a doctor doesn't want to hear it or they want to rush you off and all of those kind of things. But sometimes it's just not something they're thinking about, or we kind of have that kind of set, narrow mind. So advocating for yourself is important, going with the list so that you can get things done, and then realizing that Rome wasn't built in a day. So all the things won't be checked off on your list on one visit, but sometimes you got to split it up. So that I love that you said that.
Yeah.
So the most exciting thing that I want us to talk about in this episode is your book. Tell us about that.
Oh, you're making my heart sing. So actually, this is a card. It's just easier on camera. So it's a card that I made of the book that I have. And again, it's called the Menopause Menu. And the subtitle is just so wonderful. It's called From Hot Flashes to Delicious Dishes, a symptom-driven, nourishing guide to mastering menopause. And so my kind of pie in the sky before I started writing this was to get something out there that would be a resource, again, not a Google or a snake oil, but a helpful resource. It wasn't too medicalese, but wasn't like dumbing it down. That would be for every woman and man, everyone to really understand, come back to appreciate. And so how it kind of evolved really was, it was kind of the marriage of art and science. It was kind of this, let's get the scientific facts right, make sure I'm just, dispensing good advice. At the same time, put it together in a package that was beautiful. And I'm kind of reminiscing back to my childhood and remembering all those beautiful art books. My mother was an artist, on the coffee table where if you had 5 minutes, you just open them up and you'd turn to a page and you'd kind of drool over this gorgeous picture. And maybe you'd read something for a minute and you'd put it away. Maybe that was before the era of the internet. But, when you think about it, a lot of people don't have time these days. Like, I do know that it's good to read a book. I enjoy reading, especially fiction. And a lot of people do that when they're on their vacations or they're really trying to kind of, like a weekend, they're trying to get in the day for themselves. But when we're busy and we're pressed for time, maybe we have 5 minutes here, 5 minutes there, or maybe on a lunch break, we want to do something a little different. Well, this is a resource that people can turn to that doesn't involve reading from cover to cover. They can just jump in chapter 8 and read about weight management, or they can look at chapter 3 on sleep disruption. And even within the chapter, they can just read one page and come away with some things that are helpful. So it's just really been a super warm, fuzzy feeling to get this out there. And I'm pretty happy that it made it to Amazon. So go to Amazon and buy it.
Yes, it's so exciting. It is so important to have these resources for people because, like you said, we need to have things from reputable sources. And yes, there are some on Dr. Google, but you have to figure out how to disseminate and kind of figure out which ones are the ones that you can trust. So having this kind of menu you could pull up and say this is what I'm going through or this is what I want to learn about. Let me open it here. I experienced this today. Let me open this book. That's so important. And like you said, sometimes we have these thick textbooks where you have to kind of go through and kind of figure out what it is, and it's not necessarily meeting people where they are. So now if you have patients who are coming in and they're struggling with menopause, of course you're educating them, but we know that everyone has different learning styles. So you may pull up a YouTube video, you may have time to chat a little longer, put them at the end of the day or something like that. But now you can give them that information and educate them and then say, hey, let's look at Amazon at this resource and show them the book. So when they come back, maybe they'll have it highlighted or something and you can have a conversation according to those questions.
Yeah. And the one thing that I was really so excited by was seeing some of the early endorsements and people writing reviews from male colleagues and understanding that I have reached the audience I wanted to reach because, if you're 30, it's like, menopause, I'm just worried about having a baby, or if you're 75, like, who cares? Menopause was eons ago. I wanted to make sure that everyone could see this as helpful because frankly, assuming even if you're not, everyone knows someone that's going through menopause. I mean, that's like a given, and probably more than one. And then to get the feedback from men that they found this valuable for their partner or for just kind of knowledge base, really just made me excited. And so again, I feel like if I had this, and if it was written by someone else, and I had this because I wouldn't want to be just marketing my own product, but when I was taking care of women, I say, oh, go get this book because it's going to be so helpful. A lot of the questions you asked me today, it kind of expands on that and kind of gives you input when I'm not here or when you're not in my office. So again, I'm very humbled by this journey. Writing is not for the faint-hearted, just like podcasting probably, but it's my utmost pleasure to be of service to women everywhere in this kind of niche.
I love it. It's so important. And like you said, menopause isn't just for women. Like, men need to know about it too, probably more than women, because we're living in a society where, of course, women have to take care of a lot of things, have to take care of home. Women are probably 65% of the reason that men go to the doctor. But in addition to that, like, women are going through menopause while they're at work. So figuring out different ways and just kind of realizing what your colleagues or your employees are going through is important. And then figuring out other ways to support them, like whether or not they're your wife or your mother or someone that you care about.
Yeah. And actually I'm glad you said that. There's a big movement now, not just in this country, but other countries, looking at menopause in the workplace and how to, I guess the right word would be accommodate, or how to acknowledge and allow things that are just a little different for some women to be recognized. And, one of the easy things to think of would be like, if you miss a day of work or something, a PTO, and that it may be beyond someone's control or not kind of what they plan for that week, but it's part of that journey. And like you brought up earlier, most of us in our society we're super good at acknowledging when a younger woman is getting pregnant or they're going to have a baby or they're on maternity leave. I mean, there's so many things in place for them. There are resources. How can I help you? And of course, there's maternity leave and thank goodness some paternity leave as well. But we don't have the same setup when it comes to menopause. Now, obviously, it's different than having a baby, but there's so many hormonal changes and so many systems in the body that are impacted that go way beyond what you can even imagine, far past like hot flashes and night sweats. It could be, activation of chronic illness. It could be worsening fatigue. It could be the brain fog. I mean, I can go on and on. It could be cancer risk. And so all of that is kind of one package when you think about this midlife or perimenopausal journey. And you're right, when does this kind of naturally happen? Well, it often happens when a woman is already employed and maybe for a while and probably hasn't retired yet. And for women who have families or kids of their own, sometimes it happens when their kids are transition to high school or they're leaving the nest and they're becoming empty nesters. And so it often can dovetail when maybe parents are ill or they've passed away. And so there's so much going on and you just flaunt this huge kind of hormonal journey in the midst of it. And oh my gosh, it's huge. So I think the conversations are starting, they started and they're catching on in many countries in a good way. This is not a disability, this is not an illness. Menopause is not an illness, but it's a life transition. And I love that there's more attention given to it.
Absolutely. You couldn't have said it better. I couldn't have said it better myself because yeah, we think about all of these different stages in life, and like there are supports, and a lot of employers are looking to promote wellness, and wellness is more than a mental health day, although people may need that and it's okay to take it, but it's kind of supporting you in what you're going through and keeping you well. So menopause should be a part of those conversations.
Yeah, very much so. Yeah.
Now we're to the part, one of my final questions that I love to ask people who are coming on the podcast because the answers are so different. We know that our healthcare system kind of needs a little work. It's not exactly perfect. So if there was anything you could change about the U.S. healthcare system, if you had like a little magic wand, what would that be?
Oh, wow. I have lots of responses, but I guess my first response is kind of a powerful one. And I think that we need more respect and more understanding for the training it requires to become a physician, the dedication, the passion, the number of hours, the number of years. This is not an ego thing. And I speak about this in so many different venues. This is not like, oh, I'm a doctor, I'm important. No, nothing to do with ego. It has to do with promoting transparency in our backgrounds and our education and our experience or expertise. I have 30 years as being a physician. That was after all the training. That's different than someone who is a lovely person, perhaps, but has a very limited, part-time exposure to training, and they're still learning as they go. We now work in systems, and it's important to have teams. I acknowledge that 100%. There is no room for ego, but I think there still is room for respect. If you just step out of the medical arena, I mean, there's a lot of analogies, obviously, in the airplane world, and I think this is kind of an old one that people have heard before. But when you're on a plane, you expect a pilot to be to fly in a plane, right? And the pilot has a certain number of hours, and you hope they have more than just the minimum number of hours. There's no question. But unfortunately, in our healthcare system in this country, we, meaning the systems, have set it up where there's kind of everything's fraying at the edges. The central core is not so central. The whole burnout and moral injury stuff is just kind of bubbling to the top. And sadly, the patient is going to suffer because they're not going to feel as trusting of the medical profession because there's just a distillation of roles and titles. So again, not from an ego perspective, but I think that if everyone understood the number of hours and the energy and effort it takes to become a physician, that's a very distinctly different role than many others who are on the team. So I just wanted to put that out there.
I couldn't agree more. Let's know where to find you and to reach out for things.
Yeah. So my business is myMDadvocate.com. And that's really a fun place to just learn about me. But for patients, you have to be in Washington State, of course. My free website is MenopauseMenu.com. And that's not the book. That's just a free website for all, full of information. Under the information tab, there's 16 different sections. So there's an active blog. And of course, there's a link to my book, which is the Menopause Menu. I'm also on YouTube. So at Dr.Susan Baumgaertel and a bunch of other platforms. But I'd be delighted if anyone reaches out to me. I'm pretty friendly.
She certainly is. And I really appreciate you for coming back on the show. For the listeners out there, I will see you next week with another fantastic guest. And hopefully I won't need this water bottle and be coughing, so that'll excuse me. It was such a lovely time. And since you're a friend of the show, you can always come back and teach us about menopause and many more things.
Thanks for having me. It was a blast. I appreciate it.
Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.